So let's talk about radiating pain. This is a very common symptom we see in low back pain, and it's important to understand what's happening and how you can address it effectively. Radiating pain occurs when discomfort starts in the back and travels into the hip or groin or sometimes all the way down the leg. These symptoms can follow different patterns, sometimes associated with specific nerves, such as the sciatic nerve, or associated with different levels of the spine in areas called dermatomes. This happens when a nerve root is inflamed or compressed, which can be caused by different issues like a herniated disc, stenosis, or sometimes just tight muscles. When it comes to radiating pain, it's important to note movement preferences. Some people will feel relief when they bend forward, which is called flexion preference. This is common in conditions such as spinal stenosis. Others may feel better or have symptom relief when they lean backward, which is called extension preference and is more common in diagnoses such as a disc injury. The goal in rehab is to identify which direction works for you and use those movements to reduce irritation and promote healing. Another important concept is centralization. This happens when pain moves closer to the spine. While it may feel like pain is getting worse, centralization is actually a positive sign that we're addressing the root cause. You may notice some of the exercises in this plan provoke some symptoms. However, as you perform more repetitions, you should notice less symptoms further down the leg as the pain moves up the leg and closer to the back, which is called centralization. On the other hand, if your symptoms spread further down the leg, that is called peripheralization, and that is something we want to avoid. This is why following a guided rehab plan is so important, so you can identify which movements provoke centralization and healing. Radiating pain can feel overwhelming, but understanding the potential causes, recognizing patterns, and knowing how to use movements to your advantage can make all the difference. If you're dealing with radiating pain, do not get discouraged. Rest assured that it is normal and it does get better. However, it can be unpredictable in how long it takes to resolve. So if you're doing a rehabilitation program for a few weeks or months and not seeing huge improvement, be patient and keep working at it. If symptoms seem to be getting significantly worse, or you're seeing no improvement whatsoever after 3 weeks of consistently following the plan, then contact us and we'll adjust your plan accordingly. Additionally, you may need to be evaluated in person by a licensed physical therapist if you're not seeing any progress at all. Once again, thank you again for trusting us at Active Independent Rehab for your journey to full recovery. Let's get moving.
Hey, did you enjoy that video? If so, hit that like button.
Have any thoughts or questions? Leave a comment below.
If you want more great content and you're cool about helping us help others, please subscribe.
For more information on us and our online rehab plans, visit activeindependentrehab.com. Let's get moving.